Thousands of families are struggling financially and are in dire need of food. We had a study done this past summer by researchers at Brown University in cooperation with Blue Cross and Blue Shield of Rhode Island. And they surveyed households across the state. One of their questions was whether households were running out of food, and if they ran out of food, were they able to buy more? It's shocking, but 1 in 4 households lack adequate food. 1 in 4. The rate of food insecurity was even higher, 1 in 3 for Black and Latinx households. They're also the ones suffering the most from coronavirus disease. Black Rhode Islanders and Latinx Rhode Islanders are overrepresented among COVID cases and hospitalizations. COVID-19 has tragically exacerbated long-standing health and economic disparities in our community. Every day at the food bank, we see the plight of people who have been harmed by this pandemic recession. Before March, on average, we were serving about 53,000 people every month through our statewide network of member agencies. 53,000, we thought that was too many. Since March, we've been serving 68,000 people every month. In the status report, we document the full-out emergency response of the state in the spring that really helped to prevent widespread hunger. The Rhode Island Emergency Management Agency, in cooperation with the food bank and FEMA, distributed hundreds of thousands of meals. And at the same time, through the hard work of staff at the Rhode Island Department of Human Services, SNAP households enrolled in SNAP, saw an increase in their benefits. SNAP is the Supplemental Nutrition Assistance Program, formerly known as the Food Stamp Program. The state also acted right away to implement a new federal program called Pandemic EBT. This program targets children from low-income families who normally receive free school lunch and school breakfast. And the pandemic EBT benefits are strictly for the purchase of food, like SNAP benefits, and it goes to their parents. So these federal nutrition programs, this government food assistance made a really big difference, along with other government assistance like the extra $600 a week in unemployment compensation for recently laid off workers. The problem now is that much of this government assistance is ending. It's time limited. When pandemic EBT benefits ended in June, we saw a spike in the number of households in Rhode Island without adequate food. When the extra unemployment compensation benefits stopped, we saw more people in line at food pantries. We are nowhere near the end of this crisis. I mean, there is, thankfully, now a vaccine for COVID-19 on the horizon, but the economic recovery is going to be long and slow. And that's why we're calling on Congress to enact another COVID-19 relief bill to increase unemployment benefits and increase SNAP benefit levels. We should learn from experience and implement pandemic EBT this summer when kids are out of school again for summer vacation. And in Rhode Island, we should do everything possible to enroll every eligible family in SNAP and every eligible child in free school meals. And the food bank will need the continued support of the public and the General Assembly if we're going to have enough food to ensure that no one in Rhode Island goes hungry.